Welcome back to M Shifts, the series where we are talking about menopause, C, D, and E symptoms of menopause. With C, we have a crawling skin sensation, which means women usually feel like there are bugs crawling under their skin, or pins and needles sensation, or an itch even without a rash. It is primarily a neurological symptom of menopause. It is medically known as formication, but many a times we are gaslighted to say that it's in our head and it's not really there. It's basically the weaning levels of estrogen which are actually causing our nerve endings to become more sensitized and misfire, so to say. It is not in your head. It is a menopause sign and can be helped. Decreased libido, well, libido does go down, or desire for sex does go down as we all age, men and women alike, but women go through it 2 or 3 times more than men. There is a 30% chance that your libido is reduced, which could be because of vaginal dryness, because of irritation, mood swings, lack of sleep, all of which is part and parcel of the menopause cycle. Many women are said to say that they are more happy to give up sex instead of chocolate, but the others are also true. There is an increase in libido where you enjoy the sex better than the chocolate, but this happens primarily post-menopause. Depression, we did cover it partially when we were talking about anxiety, but it is good to say it again because 20% women go through depression. It's basically a level of emotional flatness, a sense of overwhelm, sadness, and fatigue, which is less prevalent, but there is also a downright rage that occurs in menopause. A client of mine called herself a bitch on wheels, and that's how we actually feel, because we don't want to feel this, but our levels and our disconnect with our body and mind and hormones and sleep and the sweaty night sweats are making us go through all of it. For the E symptom, there's just one, thankfully, and that is eczema or atopic dermatitis. The weaning levels of estrogen has made our skin barrier weakened, our elasticity reduced. The increased inflammation is causing us to become more allergic to things, and therefore eczema does bother us. I will be back with the rest of it in the next video. I know all of you are asking and thinking, what are the solutions to these problems? And I promise you there will be a complete take, because menopause approach is a holistic protocol. I wish there was a crocin for a fever or a pill for the depression or the eczema, but it's not one symptom and one solution. It's a holistic approach. Therefore, understanding the whole spectrum will help you help yourself better. See you in the next one.